So today I am going to introduce you to Eric Hugh, and I'll let him tell you a little bit about what he does here at Knollwood, but it's very appropriate to have him today since our topic is assisted living versus independent living. So Eric, why don't you tell them what you do here for us?
Sure. Good morning, everyone, and Heidi, thank you so much for this invitation to come and talk to everyone. My name is Eric Pugh. I'm the administrator here at the facility. And what that means that I oversee the regulatory uh, body regulations for the assisted living as well as the skilled nursing facility. Today, we're going to talk about independent living versus assisted living. So I can give you a little background about myself. I'm an undergrad, I'm a registered nurse. I have some hospital experience as well as long-term care experience as a nurse, and also, I dealt with insurances as far as Medicare Part B billing, which is, in the industry is good to understand that. For my grad, I have a master's in healthcare administration with a focus on quality as well as I'm a licensed nurse administrator. So the combination and the complement of my work experience and education, steered me directly to long-term care seniors, which is what I really enjoy doing, and that's a passion. And I'm fortunate to be here at Knollwood, which I've been here for a total of 6 months, but it feels like forever because the staff and the residents are so wonderful and very, very, very smart. And I can tell you a quick story that I started out as a nursing assistant, and my first medical director, he's here, and I still consult with him. He lives in independent living, and I'm one of the committees with him. So I'm fortunate again to work here and also to be with a group of smart residents and wonderful employees.
Well, thank you, Eric. See, we're so lucky to have somebody with so much experience in the industry to be so involved in our assisted living. So today I'm just going to go over a little bit of our goals that we're going to have. Eric, do you want to read our goals today?
Sure. Now today we have 4 goals. The first goal is to recognize the difference between assisted living and independent living. Also to talk about the acronyms that we use in this industry, as well as to understand the criteria for each level, the independent living versus the assisted living, and we'll also talk about payment options.
We always do a little bit of an overview of Knollwood. We're a nonprofit community located on 16 acres in Northwest DC. We are in a residential area, so it's absolutely gorgeous and quiet. We're right across the street from Rock Creek Park. We are a lifetime community, so we have several levels of care in neighborhoods, and we are for people who are 62 and greater. And we just want to say again, we really appreciate your questions. So please be sure to ask questions today, and it's at the bottom of your screen. You can go down to the bottom of your screen and see a place there that you can type in your questions. It's chat Q&A.
And I know Heidi spoke of our community. So last plan community means that we are continuous living, where we have the independent living as well as the assisted living and the skilled nursing facility, which comprises of long-term care and short-term rehab, as well as we have memory care.
Absolutely. So the wonderful thing about that is, as many of you probably know, as you're investigating senior living communities, that when you go to a life plan or a continual care, as they used to be called, then you can continue to live at your same community throughout the rest of your life with all the care needs that you may have.
Here at Knollwood, I would like to say that we're very, very, very unique, where we have our medical director also covers the independent living, which is very, very wonderful that we have a medical doctor and a nurse practitioner that has involvement and is able to schedule to see the residents on the independent living, which sometimes we know that going out of the community, schedule an appointment, sometimes take a long time. And also if you're not feeling well, to travel. So we're very fortunate to have a program that we just recently started, with the assistance of Heidi and other team members in the department, as well as our medical team. So I would like to share that we put the residents first. Health of the residents is very, very, very important to us because at Knollwood, we strive to be number one, as well as the residents' care again. And the residents' voice is also heard.
So we are going to do a couple of little tests today. Our goal, as Eric had mentioned, is to kind of let you know the differences between assisted living and independent living. And yes, we have other neighborhoods as well, and we will get into those with other webinars. So I'm going to read you one of these scenarios, and then Eric's going to read you one, and we'll come back later and see what answers that you think this is. So with this one, Jane and John live in a community offering socializing, educational programs, housekeeping, and dining. They both need reminders to take their medicine. Jane gets around easily and John slowly. Jane no longer cleans or cooks, but their apartment has a kitchenette. Jane has help showering. John has a stable but chronic illness. What type of community do you think Jane and John live in? So we'll come back to this in a few minutes, but write down your answer, and Eric's going to read another one.
I'm sure, thank you. Julie lives in a community offering socializing, educational programs, housekeeping, and dining options. She gets around easily, but no longer vibes at night. Julie no longer cleans and cooks less than in the past years. She has diabetes and sometimes cheats on her diet. Please, in what community does Julie live in?
So we'll come back to that in a few minutes. We're going to talk about some of the language right now that you'll hear in the different communities. So that would be helpful for you. We're going to cover that in acronyms today. So a life plan community, as we mentioned before, has all the different levels of care. There are different kinds of life plan communities. There's type A, B, and C. So type A is long-term costs that are prepaid. And that means that when you're in independent living, you may be already also paying for assisted living or skilled nursing for the future. Type B is long care discount. So you might have things discounted when you get to the long-term portion. And type C is pay only for long-term care when needed, and it's pay by service only. Knollwood is type C. So here you're going to be paying for independent living when you're in independent, and assisted when you're in assisted, and skilled when you're in skilled. I like that option. My personal belief is that it's nice to pay for what you're using because you may not use the other things. You may not ever need to go to assisted living or skilled nursing. So I really like that Knollwood is a type C. And it is a continuum care. So if you need to go to another care level, you can. And we're also going to talk a little bit about instrumental activities versus activities of daily living and explain what that means.
So instrumental activities of daily living. So that covers maintaining your household, cleaning, money management, which is very, very important. Shopping for your groceries, as well as transportation, which we spoke about earlier, and cooking, which another group of people like to get it. Taking prescriptions, which again is very important for us to stay, healthy, and also using the telephone and other devices. So with the activity of daily living, the ADLs, which is what is commonly called, which means activities of daily living. It's bathing, your hygiene, getting dressed, being able to eat, feed yourself, as well as to be able to, use the restroom, and also functional mobility, meaning walking, ambulation, which is also very important.
So here are some acronyms. We're going to go over them really quickly, just so that you kind of understand the language of the senior living. So IL is independent. By the way, we try to not use acronyms in our office because we know that it's a language to us alone, and sometimes it can be confusing. I've seen these acronyms actually in other industries that mean something different. So we try not to use them, but if they are ever used, hopefully this will help out. So IL, independent living. AL or ALF is assisted living. SN or SNF, you'll hear SNF is skilled nursing. IADL is instrumental activities of daily living, and ADLs is activities of daily living. CMS is Centers for Medicare and Medicaid Services. I'll let you read that.
Sure. As far as therapy, we have physical therapy, which is commonly referred to as PT, occupational therapy, commonly referred to as OT, speech therapy, also is referred to as SD, or most commonly SLP, and for which we have a wonderful therapy department that's here on grounds, that's available to the independent living residents as well. And we have a robust program of which we will talk about later or in another webinar.
Perfect, thank you. So we have a couple of questions coming in, and keep them coming because we really appreciate your questions. So one of the questions is, can you move directly into assisted living? Do you have to live in independent living at Knollwood first, or can you move into assisted living? So I'll start with answering, and then I'll let Eric respond as well. So the answer is yes, you can move into assisted living if we have availability. So we are a continual care community. So, some people transition from one level of care to the other. So yes, you can move into assisted living if we have availability. And right now we actually do. It's been rare for Knollwood to have availability in the past in assisted living. So right now we do. So if you know anyone that needs assisted living, please reach out to us. And do you have any other things to say?
Yes, I have a few things to say. Our assisted living, has been renovated to be more modern. We're painting. We did look at the lighting to have all the lighting to be brighter, which works good for me also because I have a little visual impairment. As also the bright lighting also gives you the sense of being outside, and gives you stability and makes you feel happy. With assisted living, we have 24-hour nursing care. That means that we have a complement of LPNs that's available 24 hours a day, as well as nursing assistants that's available 24 hours a day. And we have a registered nurse that's over the program that is on call 24 hours a day, as well as we have providers that are there also. It's led by a medical doctor, as well as a nurse practitioner, as well as we have a complement of other medical specialties, which we are happy and we boast about our medical specialties that are there. So that also helps the resident for not waiting for appointments, as well as we are able to communicate through fax or phone call or email to the resident's primary care provider that's outside. With the assisted living, we do screen the resident for the appropriate level of care. That's done by a registered nurse. And with that information, we're able to have a plan of care for that resident that's individualized. Also, we have a very, very, very robust activities program. And we have two very well-trained activity specialists that also introduce the residents, and we get the lights, as well as we have tours that go outside to different activities. Like, for example, a couple of weeks ago, the residents were able to go out to see the cherry blossoms, which unfortunately I wasn't able to do. Also, we do have housekeeping that comes once or twice a week, and more frequently if needed. And we also also do laundry as well if needed. Um, I'm sure if I said everything, I don't want to take up a lot of the webinar, talking about our wonderful program that we have.
No, that's great. Thank you. I can tell Eric's passionate about assisted living, which I love. And we call our assisted living here at Knollwood the Terrace. So if you possibly hear us talking about the terrace today, that is what we're referring to. So one other question that I got was, when do you know it's time to move to assisted living? And so I really wanted to touch on that. This is something dear to my heart. So if you're living at home right now and you have anybody helping you at all with your ADLs, which is activities of daily living, then it is time for you to move. And if you are at the point where that's not quite happening, but you foresee that it may happen, it's also a good time to make that decision. I always tell people it's best to move to assisted living when you can make the decision yourself. You want to make that decision instead of it being in an emergency situation where your family's having to make it because you've already needed. And so, for an example, if you need help with medication reminders, or even setting up your medication into little boxes so that you can take it, and then you need someone to give you a call. I have several friends that do this for their parents. Call mom every day at 1, mom, take your medicine. That's a really big sign that it's time for you to make a move. If you need help with bathing, grooming,
Yes.
so any of those things, it's really time to make the move. I think people get it in the idea that they need to be pretty sick or need a lot of help before they move to assisted living, and I would encourage you to do that before then. So. All right. We got some more, no, we've done that one. Oh, more, okay.
Additional acronyms that's specific to more so nursing
Mhm.
and administration. So LNHA or NHA is the nurse home administrator, and that's my role. Also, we have a director of nursing and an assistant director of nursing, and you will see DON or ADN or ADON for the assistant director of nursing, the registered nurse, RN, and for the LPN or LVN will be the licensed nurse LPN. Also, we have CNAs, certified nursing assistants. Also, for the CMAs, or CMTs, the certified medicine aid or certified medicine tech. The District of Columbia has passed what I want to say, I'm sorry, like the senior it's approved for us to have CMTs or CMAs that can assist with medication pass in the parish or the assisted living. However, it's still in the beginning phase. We're hoping to have that available to us soon. Also, we have agencies that come in to provide additional assistance if needed by the family. We do have a vendor on Rollins also, which is an agency that provides PDAs, and that's a private PDA, and that PDA or private PDA is usually a certified nurse assistant, as well as their companions. Companions are not certified. They're still come through the agency, and they are able to, sit and talk with the resident, or to go out in the outing, or to, just to walk around the campus with the residents.
And I just wanted to really touch really quickly on the difference between a caregiver and that's a CNA, which is a certified nursing assistant, or a companion. And the reason why that's important is because some of you at home may already have companions. So a companion is going to be somebody that comes in and they are going to maybe help you with meals, maybe like duties at the house. And really they're there to kind of make sure that you're safe, that you're not lonely, that maybe my mom is 75 years old and she works as a companion. Now she couldn't work as a caregiver because she can't do the lifting and the moving of people. she would injure herself at this point in her life. So a CNA is licensed, they are trained. And the reason why that's important is a companion isn't trained on how to change your shirt and things like that without hurting you or grooming you. And so often people will have a companion, whether than a CNA at home, or they will end up having a CNA. So those are very big differences. If you are needing extra care with grooming and your ADLs, you want to certainly look into getting a CNA, not as a companion. And that's when you know it's time to come to assisted living where we have CNAs. So,
Yes.
all right. We have another question. I know we got to keep this moving along. It says, is there a separate space for memory care? So yes, we do have memory care here, and our memory care is a little special to me. I love memory care. I worked in a freestanding 65-bed memory care for a few years and love it. And so memory care can be under the umbrella of skilled nursing, or it can be under the umbrella of assisted living, and it makes a very big difference on what kind of services can
Yes.
be performed there. And so I've had to discharge people in memory care before in some of my assisted livings because of their mobility, or maybe they no longer could feed themselves and needed to be fed. Maybe they had swallowing issues. So our memory care here at Knollwood is under our skilled nursing, and I find that to be less challenging because you don't have to discharge people if they have greater needs, and that often happens with some of those diagnoses. So,
And as Heidi said, we have a wonderful, wonderful memory care unit, memory care program. We do have a lot of activities there that's designed specially for the memory care unit, as well as we have animal therapy, pet therapy. We have a huge fish tank for which I really love, because I was instrumental in putting it together and putting the wonderful fish that are there. Also, we do have activities such as music from the outside. We had a piano player recently that sung. We also had a classical music band that came in, as well as other activities. Also, our memory care unit has a huge outside area, which we're putting together right now, which we're having a lot of flowers and greens, as well as we're getting a bigger grill. And the goal of that is for us to have the families to come out at least once a week to have a family style barbecue and to spend time with your loved ones. Also, we have a nice complement of staff. We have 2 nurses in the morning, a registered nurse, and LPN, and also 4 nursing assistants, and the same schedule for the afternoon. And then on the night, we have a registered nurse and 2 LPNs. We have a total of 23 beds on that unit, so which the complement of staff, far exceeds the DC requirement. So with that being said, there's more individual one-to-one care, as well as we have providers that are available 24 hours a day, as well as we have a therapist and a psychiatrist, a social worker, and again, the rehab department and other specialties that are available for the residents on the memory care.
I just want to touch really quickly to let you know as well that the memory care is a secure environment as far as, it's a code door to go in and out. And the beautiful garden, the memory garden that Eric was talking about, is also all secure. So I know that question has come in the past, is if our area is a secure environment and it's a secure outdoor area. So yes, it is. All right. All good information.
Please keep the questions coming.
Yes, absolutely. So here's some different comparisons kind of between independent living and assisted living. So if you go out and you're touring for communities, sometimes someone will be licensed under independent living only or assisted living only, or sometimes they'll have a dual license. I've worked at communities that do. And there's pros and cons. I'm not going to go into it here, but if you are out looking at independent living and you truly just are looking for independent living and you don't necessarily want the mixed environment, here at Ours is not a mixed environment. As you know, we have the different neighborhoods. So independent living has full kitchens, where if you were touring and you saw kitchenettes, then that's probably more assisted living. Independent living usually has optional dining plans where in assisted living, dining is included. And most residents have a car in independent living. You don't usually see that in assisted living. Some people can, and sometimes it just depends. It's just less likely you're gonna see a full parking lot of resident cars in assisted versus independent. And in independent livings, there's usually lots of different floor plans to choose from, where assisted living is a little bit more standardized. And then there's not a license need for independent living, where there is licensing for assisted living. So those are just kind of some of the differences when you're taking a tour, when you're trying to understand what kind of community you're in or looking at. Those are some of the helpful hints. There are also helpful hints for the little test that we took if you caught any of our keywords.
Yes. And also I want to talk about our robust dining room experience in the assisted living, for which we have a dining room that's we strongly encourage residents to use. We have it where they're served, and also there are different options for the residents to choose from, as well as we have a medical staff that's there throughout the whole dining experience, in case if there's an emergency or any need that's immediate. Also, we have a dietitian. Didn't have talked about earlier when we spoke about the different medical specialties. So the dietitian sees the residents upon admission and monthly, and she monitors the residents' intake, as well as if there is a need based on lab work or any referrals from the provider.
There's lots of options as well when they're picking their dining experience. They can, choose their, like Eric said, they can choose their own meals, and people often ask about low sodium or low sugar, and we absolutely can do those things. So ability to wisely and safely manage a household. These are more of your eligibilities. Okay, so these are what you need to be able to do to move to independent living. So here at Knollwood, to move into our independent living, we do ask and require that you are completely independent at this time. And these are some of the ideas of what that means. So ability to wisely and safely manage a household, free from care and cognitive impairment, realistic expectation to live 5 or more years independently, and personal funds to last your life expectancy. So a lot of times people ask, so why do people move into independent living? So independent living is a great environment. The reason why people are attracted to moving is maybe you're just tired of home maintenance, or you have a lot of stairs in your home, or maybe you're lonely and you like to be more in a community environment. Maybe you don't want to eat alone. Maybe you recently lost your spouse and you don't enjoy living alone. There's so many different reasons people move to independent living. Last year, I moved a guy in because he said, my furnace broke. I said, the next thing that broke in my house, it was a sign I was moving. So there's just, I have another lady that's moving. She wasn't going to move for a while. A neighbor offered to buy her home. She said, this is who I want to sell my house to. This works out perfectly. It's a sign. So there's just different reasons why to move to independent living. But it's certainly before you need care with your ADLs, activities of daily living. Assisted living, I'll let Eric talk about the differences and what eligibility you need for assisted living.
So the eligibility for assisted living is the ability to live safely, within their apartment on an ongoing basis. Also to, be ambulatory to move around the community, and not so much on your own. But we're able to assist also to move around. So, and I want to expand on moving around we're on 16 acres, and the different levels, for example, the independent living and the assisted living, this is all your home. You're able to attend activities over in the independent living area also, as well as to eat in the bistro in the independent living also. Um, and also to use the pool. And there's a criteria to use the pool. Where, we just require that you're continent, as well as, we do have, lifeguard, 5 days a week. And also we have, physical therapy, water aerobics. Also, you should be able to transfer, independently, and if you're not able to, open assessment, we have our physical therapy, occupational therapy department that can assist, with, strengthening and, teaching, and as well as adaptive devices. To eat without help also, if we see that, or, we're aware that you need assistance with eating, we have a speech therapist. That's very, very wonderful. Where, the speech therapist will assist and assess also. And also, one thing that we brag about is that we have a program that's called, fees and please, I'm sorry, I can't remember right now, but basically it's a swallowing test. That can be done at the bedside by a specialist, speech therapy that comes at the bedside. We can have that test done to, see if the following of eating is, based on swallowing. And also there's adaptive devices that, occupational therapy with the speech therapy can assist to, put together, for their resident to eat, as well as will involve the dentist and dietitian.
And I just want to really, sorry to interrupt you. I just want to say, if you needed your food cut up
Yes.
or something like that to make it easier for you to eat, we do that. in assisted
Yes.
living, right?
Yes,
Yeah.
we do. We can do it 2 ways. The kitchen upon preparing it will do it, as well as, the medical, staff, the nursing assistant or the nurse can do it upon delivering the warm food.
And Eric, here's a question I think you'd be really great at answering. What medical needs makes you ineligible for assisted living? And I want to say before Eric answers this question is also, it's a state regulation question, but it can differ on communities because different communities may have different licenses.
Yes.
So,
As far as our assisted living, we do have, different levels, in our assisted living. So as far as being ineligible, we would like for the resident to be able to express, that's number one, and to be able to, transfer, and at least to be, ambulatory. Nothing ambulatory, that doesn't mean that you cannot walk without a walker or later or can, just that you're able to move on. But we still provide assistance with, walking if needed. And also, the the basic, monitoring, like for example, if you had a G2 where you're not able to eat, and, anything that, would require, more like a close one-to-one or more hours by the, nurse, that would make you, ineligible also. And then that would recommend our, skilled nursing facility.
so when Eric says being able to express, that's, we want somebody in assisted living needs to be able to express their needs, express that they need to use the restroom, express that they're hungry, express that they're in pain. So that's kind of right.
Yes, so, that's correct.
Okay, and then with being ambulatory, as Eric said, you need to be able to get yourself around, but they can help as well. The way I like to think about it is if you're in a wheelchair and you can do this and get yourself with your hands or your feet, you've seen people scoot in the wheelchair. So that's still ambulatory,
Yes.
correct?
Yes, it
Yeah.
is, yes.
So that's kind of, I just wanted to make sure that we're explaining that okay. If we're not, please type in your questions. So, all right. I think are we up to no, we're not to our answers. I'm getting anxious to share our answers for our test. Okay, so more regulatory comparison. So independent living has less regulation on the state level. There's really no care license, as we had spoken before. Assisted living, heavy regulation, state level. There's license to provide supervision, personal care. registered nurses. So there's a lot of different regulations, which we're grateful we have people knowledgeable of to keep us on track in assisted living.
Yes, so here at Knollwood, even though there's a different regulatory body for assisted living, that's regulated by the Department of Health in DC. The independent living mostly falls under housing. However, we do you know, treat both sides of the house similarly. If we see a need for example, the involving a provider, a doctor, the psychiatrist, the therapist, we will do that. The dentist, we have a dentist that comes there also, as well as a optometrist that comes also.
And
So,
pediatrics, right?
Yeah, a podiatrist
Yeah.
also, and a dermatologist.
Yeah, and a massage therapist.
Yes.
And the list goes on.
This goes on. So when we think about one side, we also think about the other side. So all of that's available on the assisted living, as far as the specialties and the other components, we also make it available to the independent living residents.
Oh, we're finally here. All right. So do you remember Julie? She lives in the community offering socializing, educational programs, housekeeping. So do you remember, and do you know what kind of community Julie lives in? So there's some hints here. Let's see what the hints are. So she has dining options. She still gets around pretty easily. She has diabetes and cheats on her diet. Okay, where does Julie live? Da-da-da, drum roll. So Julie lives in independent living. So, you know, she doesn't drive at night. You know, I don't drive at night. Doesn't mean I need assisted living. I just don't like to drive at night. And she still cooks, but she's a little less, and she can't cook because she still has a kitchen. So there's some of your little clues.
Yes.
All right, on to the next one.
Next, we have Jane and John, who lives in the community offering socialization, education programs, housekeeping, dining. Both needs reminded to take their medication. Jane gets one easily, and John is one slow. They no longer cleans or cooks, but their apartment has a kitchenette. Jane has help showering. John, you know, he's stable, but he has chronic illness. So the keywords that I look at here is kitchenette is one, and needing assistance with the activities of daily living, which is, you know, with self-care, and also needs help with housekeeping and dining.
Ta-da.
So the answer is assisted living.
All right. And it looks like we have another question coming in. Thank you, OBC. To what extent does long-term care insurance cover assisted living? So that is an excellent question because this is going to depend on what kind of long-term care insurance you have, what kind of coverage. We do a long-term care workshop about once a year. We really dig into that policy. So if you're interested in attending that, please give us your email, contact us. And if it's something that you want to know more about, you actually can come in and meet with me personally, bring in your policy. I'll go over it with you. I'm not an expert, don't sell insurance, just have seen a lot of them over my career. So it depends on your policy, but yes. So long-term care insurance is set up to pay for assisted living, home care, or a private aid, and skilled nursing, depending on your policy. Okay, Medicaid covers assisted living costs. Is this true or false? What do you think?
Well, for our community, no, we don't have to Medicaid. Cover the costs.
So yeah, exactly, mostly false. So for example, there's only 2 assisted living properties in DC that have Medicaid waivers. I've seen a few throughout my career. I've worked at a couple, but it is usually a very long wait list, up to 2 to 3 years to get onto a Medicaid waiver assisted living. So the thresholds are different state by state. There are a few states out there in our country that requires every assisted living to have a certain amount of Medicaid beds. But we're not one of them here in DC. Medicare covers assisted living costs, true or false? False, again, false. So Medicare covers short-term stays in skilled nursing for people who have conditions that will improve with therapy. And additional requirements must also be met for your Medicare to cover. It doesn't cover assisted living, it covers short-term rehab.
As well as some short-term nursing needs, also
Yes,
skilled nursing needs.
correct, yeah. So independent living is paid by personal funds. And assisted living could be paid by personal funds, long-term care insurance, or Medicaid if you are in one of those rare states I talked of, or you get on a Medicaid waiver and wait until they have the availability. So here's some comparisons at Knollwood. So 69% of independent living. Our community is mostly independent living. We have singles and couples, many different sizes of apartment homes and styles in our independent living. And when you move into our independent, you have priority to go to assisted living, skilled nursing, memory care, rehab, any of those other levels of care that you may need. 31% assisted living, skilled nursing, mostly singles. We do have some larger apartments in assisted living, but most of them are a standard size. Deficiency-free survey, priority access for rehab, long-term care, and memory care as well. So we are wrapping this up. If you have any other questions, feel free to give us a call. You're also welcome to send us an email. We're really grateful that you came in today to learn more. You can also see our past webinars. These are live and they get recorded. This one will be up on our website probably within the week. We also have past webinars. We have assisted living versus nursing care, which is a really interesting webinar, and that will be our next one on May 7th. So please visit our website. You can register to come onto our webinar. Thank you so much for Eric joining us today with all of his knowledge and experience.
And I want to tell Patty, thank you for the invitation.
Yeah,
Hope to get another invitation soon.
yeah, maybe for the next one with skilled nursing. So yeah, all right. Well, have a wonderful day. And if you have not toured Knollwood yet, give Heidi a call or Helen. We'd love to meet with you in person and share more with you. Bye.
Thank you. Have a great day, everyone.